Very good morning, one and all. Today, we are going to discuss about adrenergic antagonist classification, structures, and the uses. The last class we discussed the classification of alpha and beta blockers. Today, we'll discuss structure and the uses. So once again, we'll discuss classification of alpha blockers. So this type of drugs used to inhibit the functions of adrenergic receptors. So the opposite alpha receptors. So we classify into three main categories. One is non-selective alpha and beta blockers, selective beta alpha and beta alpha blockers, miscellaneous. So non-selective drugs such as divided into two types. One is reversible, another one is irreversible. Reversible, we can say that phentolamine, tolazoline. Irreversible drugs such as Phenoxybenzamine. Coming to the selective drugs, alpha 1 blockers, alpha 2 blockers. So alpha 1 blockers, we can say that prazosin, terazocin, doxazosine, alfuzosin, bunazosin, tamsulosin, silodosin. These are drugs comes under alpha 1 blockers. Alpha 2 blockers, yohimbine, daxazosine. These are drugs comes under alpha 2 blockers. So miscellaneous drugs, we have some alkaloids, name is ergot-alkaloids. Coming to these beta blockers, we divide into three main categories. One is first generation, another we can call it as non-selective drugs. Second is second generation, we can call it as beta 1 selective drugs. Last one is third generation. First generation drugs, propranolol, pimdolol, nadolol, sotalol, pimdolol. Second generation drugs such as Atenolol, acebutolol, bisoprolol, esmolol, metoprolol. Third generation drugs classified into again subdivided into two types. One is non-selective, that means alpha 1 and beta drugs such as carvedilol, labetalol. Selective drugs nabivolol, betaxolol. These drugs comes under third generation categories. Now we can say that structures as well as uses. So first one is Phenoxybenzamine. This drugs comes under three atomic present in the structure: nitrogen, oxygen, and chlorine atom. This drugs comes under present Phenoxybenzamine. These drugs mainly used to treat high blood pressure and heavy sweating due to the tumor of adrenal glands. We can call it as pheochromocytoma. This drugs comes under alpha blockers and also works by relaxing and widening blood vessels so that blood can flow more easily to the body. Next one is prazosin. This drugs mainly used to treat BP, high BP. If it is present low BP, used to prevent strokes, heart attacks, and kidney problems. These drugs comes under alpha blockers, mainly works by relaxing and widening blood vessels so that blood flow easily to the body. Next one is dihydroergotamine. This is one of the alkaloids. That means ergot-alkaloids. So mainly works by narrowing the blood vessels around the brain and affect blood flow patterns that are associated with certain types of headaches. So dihydroergotamine injection is used to treat migraine or cluster headache attack. So ergotamine alkaloids. These ergotamine alkaloids mainly used for head attacks. Next one is methysergide. Is mainly used to chronic migraine or episodic migraine. That means mainly for head attacks. We can simply say headache. It is one of the most effective medication for migraine, but it is not instant for treatment of acute attack. It is to be taken daily as preventive medicine. Next one is propranolol. It is mainly used for chest pain. We can simply say that heart attack, angina pectoris. So and also rhythm disorders. It's mainly used to treat heart or circulatory condition. In this condition is to prevent heart attack and reduce to severity and frequency of migraine, headaches. Metoprolol is one of the ophthalmic product mainly used to increase the blood pressure in the eye to can lead the gradual loss of vision. It comes under beta blocker drugs, mainly decreasing the pressure in the eye. Next one is Atenolol. These are drugs mainly used to treat the high blood pressure, that means hypertension. If it is lower blood pressure, prevents strokes, heart attacks, and kidney problems. It mainly used to treat chest pain to improve and survival after heart attack. So betaxolol is also one of the alternate product. So used to reduce blood pressure in the eye. Comes under beta blockers. This prevent gradual loss of vision. Next is bisoprolol. This drug is used to with or without other medication to treat the high blood pressure, hypertension. If it is lower, used to prevent stroke, heart attack, and kidney problems, same as Atenolol and Propranolol. This medicine used to blanks comes under beta blockers. Next one is esmolol. This one drugs used to control rapid heartbeats or abnormal heart rhythms. This medicines is used to treat fast heartbeat and high blood pressure during the surgery. After surgery or during the other medical procedure. So mainly used for to control the heartbeat, maybe increase or decrease, used to control for that. For usually mainly using for isomalol drugs. Next coming to this metoprolol, this drugs comes under beta blockers and also affect the heart and circulation. That means blood flow through the arteries and veins. It is mainly used to treat angina, that means chest pain and hypertension. If it is lower risk or risk of death or needing to be hospitalized for heart failure, mainly used for metoprolol. Next one is labetalol. This drug is without medicine to treat the high blood pressure. If it is lower blood pressure, is to prevent stroke, heart attack, and kidney problems. So it comes under alpha blockers and beta blockers. Next one is carvedilol. So this also comes under beta blockers. Is to treat cardiac failure, that means heart failure and hypertension. So mainly used to cause your heart do not pump as well as mainly used for heart attack. Next one is phentolamine. This phentolamine drugs basic nucleus present is midazoline with alpha adrenergic antagonist activity. As competitive alpha adrenergic antagonist, phentolamine binds alpha 1 and alpha 2 receptors, resulting decrease the peripheral vascular resistance and the vasodilation. So this phentolamine is mainly alpha adrenergic antagonist activity because bunazosin is present in this structure. This drug is easily bind with the alpha 1 alpha 2 receptors and releasing the activity to decrease the peripheral vascular resistance, the vasodilation activity. Next one is terazocin. Terazocin is a non-selective competitive alpha adrenergic receptors antagonist. It's mainly used to treat vasodilator action. This is to spasm of peripheral blood vessels. So thank you to all. Today we discuss about classification as well as uses. Next class we will discuss synthesis of adrenergic blockers. Thank you.